election. Ladies and gentlemen, welcome to this webinar where I'm going to try and give you a feel for this new master's program that HCRI is running. If you'll bear with me for a second, I'm going to share my screen with you and talk to a presentation just to give you a little bit of an outline. I'm planning on talking for a period of time. Then when I get to the end, I'll take the screen share off and endeavour to answer any of the questions. Because of the way this has been set up and because we weren't sure how many would be joining, to protect bandwidth, your cameras are all off and you're all muted, or should be muted. If you'd like to ask questions, if you could open the chat function. For those of you that are not Zoom aficionados, if you bring your mouse towards the bottom of the screen, you'll get a little toolbar, one of which is chat. If you click on the chat, you'll get a white bar to the right and the Zoom group chat. Make sure it says to everyone, and there's a type message here, and that's where you put your questions if you wouldn't mind, then everybody can see. Right, let me try and make this work. Okay, you should be now seeing my screen. Lucy, is that working from your end?
Yeah, that's all working.
Okay. This webinar is basically me telling people about what we have planned to start in September. It's our new Masters in International Disaster Management and Humanitarian Response. What I'm planning to do is give you a little bit of a background to what HCRI is, the background for the International Disaster Management Humanitarian Response program, and a little bit about our online programs more widely at HCRI. Then we'll get into what you'll be looking at, what you'll be studying if you joined us, talk a little bit about what is involved and how the program works. And because I wrote this morning, I forgot to delete the second what is involved. I will only do that once. HCRI started 12 years ago. It was formed by a group of academics at the University of Manchester because it was recognised that the University of Manchester needed to move into the social responsibility area, and there was a demand for a centre of excellence for humanitarian action. A number of our academics have been involved in various disasters around the world, and they came together to create HCRI as part of that. It's multidisciplinary. It brings together academics, practitioners, and policymakers. We consider it social responsibility in action. Social responsibility was one of the three arms of the University of Manchester's strategy. It's truly multidisciplinary, bringing together medicine, science, and the humanities. We're part of the University of Manchester. We are an institute within the School of Arts, Languages and Culture, within the Faculty of Humanities of the university. And we deal with humanitarian aid, disaster management, and conflict response in our various guises. I felt I should give you a feel for some of the specialties that we have. Our director is actually a professor of modern history, but we have anthropologists, sociologists, links to politics and international relations, several geographers. I'm personally a consultant in emergency medicine who now specialises in global health. We have epidemiologists, we have a number of nurses, and we are involved with development and peace studies. And a relatively new innovation, we're also involved in humanitarian education. So we are a mixed bag. The corridor is very multidisciplinary with a wide breadth of knowledge and experience. HCRI's online programs started in 2012 with the first program being taught in 2013. The three pictures you have there is our current director, Bertrand Taith. The next is Tony Redmond, who's recently retired, but he's Professor of International Emergency Medicine. And Ronnie Broman on the far right was president of MSF. And those are three of the key characters who in 2008 set up HCRI. The online program was one of the earlier programs in global health only at that point. But this is a dynamic and evolving environment, and we're responding to need. What we're interested in is people actually doing it, not just sitting in an office pontificating on how it should be done. And part of that is illustrated by HCRI hosts and shares office space with UK Med, which is the emergency medical team for the UK. As described, funded by the Department for International Development, described by the Minister as the NHS PLC. It's the NHS being shipped overseas to provide response to international disasters, and the picture on the right there is from Typhoon Haiyan with UK Med deployed alongside the UK military in support of the people of that part of the world. The University of Manchester online suite of programs, as I indicated, began with the MSc in Global Health in 2013, and I've been involved since shortly after that. We started a Master's in Humanitarian Practice in collaboration with Médecins Sans Frontières in 2018. And we now have, starting this year, an MA in International Disaster Management and Humanitarian Response, and that's where I'm going to focus this afternoon. This is constantly evolving, and I need to, as I've been made the director of online programs, and our aspirations are to mirror all our face-to-face programs. So most of the programs that we offer can also be done full-time on campus at the University of Manchester. And we're trying to mirror all those. The area that's currently missing online is peace and conflict studies. And we're hoping to get that online in the next 18 months or so. The other side is the format is fairly tram-track at the moment. There are 8 taught modules, as I'll explain, but we're moving to increase flexibility. It doesn't apply to this year's entry, but I would hope for your next year, your year 2, if you joined us this year, you would have the ability to select some of your modules for your second year. This is a work in progress. It's evolving in front of our eyes. We are trying to bring ourselves up to speed to something we can be truly proud of. So why disaster management? Why humanitarian response? I just want to give you a feel for some of the questions that we ask. You can be truly academic. You can take the principles approach and look at the disaster management cycle and work on preparedness, response, recovery, and prevention mitigation. You can see the cycle there, and if you do our program, this will be tattooed on your forebrain relatively early. But we then try to take that and apply it, because the problem is real and broad, and this, the link is at the bottom of this slide, but this is the most up-to-date data we have, and you can see the numbers of internally and externally displaced persons, the areas where disaster management is focused. HCRI has involvement particularly in Southeast Asia and Sub-Saharan Africa. We have 1 or 2 academics with interests in South America. My own personal interests are largely in Central and Eastern Sub-Saharan Africa. But you can see it is a truly global problem. But there are iconic disasters, and you will have all been aware of Hurricanes Irma and Katrina, now some time ago, I would admit. Haiti, 10 years ago now, Haiyan, 7 years ago. They're the iconic disasters. They're the ones where people have said, we must do better, never again, all the usual mantras after action reports saying we must do better. But actually, that's just headlines. We need to get down into the nitty-gritty. And there are urban disasters and unique challenges in cities. More and more people are being displaced, and they're not being displaced necessarily across international borders. They're being displaced into cities, into urban environments, and how you manage that is uniquely challenging. But we still have the rural disasters, and we have a new lecturer arriving with us in September whose focus is largely on climate change and the effects of climate and climate change on rural survival is a slow burn, if you'll pardon the term, for disasters that are going to develop. Water security, water wars are being talked about in parts of East Africa and the Middle East, and how we manage that in the coming years will require some careful analysis. We have the slow onset disasters such as droughts, but the linkages to migration and the environmental climate change refugees. We're starting to see papers coming through on that. The thinkers are starting to work out how we might approach that. You will explore that in some of the modules that we will be presenting to you. It's not all overseas. There are unequal disaster impacts. This is obviously Grenfell Tower. There are a number of other examples in developed or high-income countries where the social determinants of health, education, shelter, food, hygiene, education, they're all critically important in low and middle income settings, but even in high income settings, they can be significant factors that impact on disaster preparedness and response, and certainly the recovery afterwards. But they're increasingly taking place in conflict affected areas. Where does international humanitarian law sit here? What do the ethics say? How do the United Nations organizations, how does WHO and UN OCHA play in when there is active conflict going on? All complicated perspectives that break out from the simple disaster management and humanitarian response headlines. And the big issue is about refugees and why do they leave their homes? What challenges do they face? How do you best respond to this? All part of our program. And because we're health, we do look at international organizations navigating the different social and cultural spaces. We learned a lot of lessons, perhaps say, we identified a lot of lessons from the Maru River disaster of the Ebola outbreak. Whether we learned them, we still need to see. So I would highlight to you the United Nations is now 75 years old. This is an ideal time for us to be opening up a new Masters in Disaster Management. The Sustainable Development Goals are 2015 to 2030. The first 5 years have built on the Millennium Development Goals, but momentum is stalling. And early in this year, in April of this year, the United Nations mobilized to what they're calling a decade of action, 2020 to 2030, to really grasp the problems in the low and middle income areas to try and make them more resilient and more able to respond to the sort of disasters and the sort of human tragedies that I've outlined in the slides that came before. So, you're interested in the program, what is actually involved? Well, our online programs require approximately 15 hours per week of engagement. It is asynchronous learning. That means that you do not need to be online at a particular time every week. You can go in and you can access the learning materials in our Blackboard environment, read them, see them there, or download them and see them offline. But you do not need to come together real time at a particular time. Our online programs are global, and we've had students in Cambodia and Laos. We've had them in the Caribbean, and trying to get everybody into one place at one time each week is not really practical. So we are asynchronous. And we run directed group discussion. You're in a classroom, you do the material, and you engage in interactions with the course convener, with the other supporting academics, and with your peers on a week-by-week basis. Each module lasts for 8 weeks, and then there are 2 weeks at the end of the module to give you some space to do the assessments for that module, and you submit the assessment for the previous module on the first day of the next module. We do allow a 1-week break for Christmas and Easter where things are suspended. That means the total academic engagement is 42 weeks per year. We start at the end of September and run to early July for the September entry. As you'll have seen from the advertising, this will be the first of our online programs that will have twice a year entry, and we will be entering people for semester 2, which starts the very last week of January, and everything will shuffle. The 42 weeks will shuffle forward in a semester fashion for those who choose to come at the end of January, early February. The program outline, this is part-time and fully online. To get a postgraduate certificate, you need 60 credits. A module is 15 credits. So you do 4 modules in a year. You could exit if you chose with a postgrad certificate. If you met the grades and you wish to progress, you can do the taught diploma by doing another 4 taught units, and you would have 120 credits at the end of the second year. And if you chose to go on and do the full masters, in your 3rd year, you would do a dissertation, which is 60 credits, and that would lead you to your masters. In terms of what you will be doing, I've listed the 8 modules as they currently stand. The first, risk, vulnerability and resilience, is largely about quantitative research and about getting your heads around the use of numbers in humanitarian environments, when you can use standard quantitative statistics, but in reality in a disaster you're having to sample, having to do qualitative evaluation, and how does that impact on your quantitative analysis. Then emergency humanitarian assistance, actually how it's done, who are the organizations that are players, how does it work. You then do disaster preparedness, how are things set out to give resilience before things get going. And community approaches to health is where you will share with some of our global health and humanitarian students exploration of the role of sustainable development goals, and perhaps adjust your priorities in understanding the response to a disaster. This is not about intensive care and major surgery to tens of thousands of people. With tens and hundreds of thousands of people, this is about making sure they're sheltered, they're fed, they're watered, and their effluent is dealt with safely, as well as providing healthcare. If you go on to do the diploma, we'll start to look at the recovery and reconstruction, start to think about how to deal with people's mental health and support them in restoring normality, or restoring the new normal for them. And then the humanitarian and conflict response inquiries is about how you analyse and report on disasters. And the research methods in global health is our qualitative research module, and it prepares you for your dissertation. Having done the quantitative, in the qualitative, we demonstrate to you the range of methodologies that would be acceptable for a research question in your dissertation. The dissertation itself is a student-generated one. You develop the research question. We don't have a pick and mix list. We work with you over the first 8 weeks of the dissertation module to create and refine a question that's interesting to you and where you have access to the resources and the people to try and answer that question. We will explore with you the ethical issues. Research ethics in a disaster environment can be a real challenge. With that dissertation proposal, with a research question and some of the substance underneath, we will allocate you a supervisor. You will then work one-to-one with a supervisor over the following months to create a 12 to 15,000 word thesis. You can do primary research if you wish, but it is not mandated. There are ethics problems, and ethics committees normally look to vulnerable people and vulnerable children and at-risk environments and say, you need to do a lot of work to be able to get ethical approval to do research in that area. And by definition, disasters tick all their red flag boxes. Getting through research ethics can be difficult, but we have done it. Many students choose to do secondary data research in our dissertations, where they have access to data sets that have been gathered by NGOs, and they do research and further analysis on that data. But we're also perfectly happy to accept secondary literature analysis and policy analysis as part of a dissertation. And we'll work with you to create a functional dissertation that you can really get your teeth into and be proud of what you produce. Our format in each module is a consistent one. As I said, it's in Blackboard, but there's a notice board where we can send things out. We have the module content, reading list. You would have access to the University of Manchester Library, all electronically. We have a discussion board, a learning journal for you to keep tabs on what you've been doing. Of course, there has to be assessment, I'm afraid, and we do provide learning support. There are various resources from the School of Arts, Languages and Culture in how to write essays for humanities, in how to approach the different assessments, and in how to use referencing software and how to use search engines to identify the literature. All of that is available and provided by the university and by the academics that will be supporting this program. And this is just a screenshot of one of the modules to give you a feel for the format that we currently use. Synchronous meetings are a challenge because of the time zone differences. This is designed for people to be part-time. They're often workers on shift, and being the same time, same place every week is impractical. We do run some discussion sessions where you can get online with the tutors, ask questions and have conversations. And we always record those and upload the link into Blackboard so you can see them offline if we use them. But we find that they're not particularly practical unless the students are wanting them during the formal taught modules. It does work for the dissertations. Perhaps it's because the 15,000 words has focused the student's mind. They can see the light at the end of the tunnel. They can see their cap and gown, and they do come together from across the world. I've just been supporting a student who's been joining the meetings at 3 a.m. in the morning from Sydney, because most people have been in Europe and we've been running them mid-late afternoon for the convenience of the majority. So we do them, but they're not a formal part of the program. Need to give you some of the university rules. The 60, 120, 180 credits for an award are non-negotiable for anybody. There is a 5-year maximum from entry to completion. If you ran from beginning to end, that would be 3 years. There are mitigating circumstances. Things happen in life. You can interrupt. You can apply for a mitigation where they will give you an extension or an opportunity to resubmit. Some of our health professionals step out to do professional exams and step back on. All of that is permissible. And my favorite interruption is a young lady who sent her mitigating circumstances in, and it does require some evidence. So can you provide a medical certificate? And she sent a photograph of a premature baby and his birth certificate and said he arrived 2 months early. Can I have mitigating circumstances? To which the answer was obviously yes. When would you like to come back? But that's perhaps my favorite one. She sent a picture of the baby in an incubator. In all of these, the university is fairly rigorous, but we are pushing them to be flexible. I am the program director for this master's, and there are no no's that you can't come and talk to me about. And if I can push the rules and bend the rules because your circumstances require it, I will do my best. I will negotiate with the university on your behalf to try and make it fit for you. But the university, at the end of the day, is a Russell Group university. It has to have strict rules, and I have to abide by them. I just try to chew away at the edges if the students are asking me to. We do get there. This is from December last year. These are some of our students. The lady on the far right did her primary research with the people of the San in Namibia, and the gentleman on the left did his dissertation as an entirely secondary data thing on pharmaceutical integrity in low-income and disaster settings. And we have significant success at master's level. So I've talked enough. This is a situation where I invite you to type questions in the chat area if you have any, and then I'll pick them up. And if you have anything else, then please raise a hand up, which again is used at the bottom of the screen. Ask me some questions and I will endeavour to answer them.